How's everyone doing today? Dr. Rob Kiltz, live. Guess where? Yes. And it's a beautiful day, and I'm sharing some thoughts and ideas how we can all improve whatever we're doing in life. And let's see here. I'm just trying to adjust my camera ever so slightly. Thanks, everyone, for bearing with me. Modlab, how you doing, sassy Southern girl? Sanir, hi. Let's see. Dr. Radish Brown, hello. Allie, hello. Yarly, hello. Let's see. I've got my YouTube and Facebook there, my Instagram here, and I'm down, south, and working on getting us going here in Sarasota. Really excited about it. Be doing monitoring probably for the next 3 to maybe 6 months and getting our IVF going. Hello to Vanessa. Good morning. Jesse, good morning. Heather, good morning. Good morning. Good morning. Rachel, good morning. It's a beautiful day, and every day is a God-given day, right? And whether you believe in God or not, it's still a gift that we are here and alive today. Let's see. Nima, NY Ima, hello. D Boof, good morning. Good morning. Rebecca, Lynn Anderson, hello to you. And here to sort of inspire all of us, I need your inspiration every day. And we all feed on each other. We all groom each other. We all guide each other. And with some love and connection and creativity, we're doing our very, 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 very best, right? I am doing great, rejuvenating, yes. Platelet-rich, PRP, platelet-rich plasma as an intrauterine or intraovarian rejuvenation may help reduce inflammation, increase blood flow, and increase implantation and egg quality. Now, like anything else in this world, we're all doing something to improve, but we all can't always guarantee the outcomes. These are the challenges. It's not necessary to do kiltz keto, by the way, or be in ketosis. Let's see, I think I have, hold on 1 second, everyone. I'm really excited about, I had to go over there to get this Kiltz's new keto book, magazine, whatever you want to call it. But again, whether you're a vegan, vegetarian, carnivorian, or pescatarian, they all work, and you don't have to be in ketosis. Kiltz's keto lifestyle is limit the meals, go to 1 at night, rest and digest, and add the fat, cook the carbs well, and don't forget some salt and all of that. Let's see, about coming from Montana, Ashley, let's see. Oh, you're pregnant. Awesome, awesome, awesome. And look at so many of the things that we're sharing. When you're doing Kiltz's keto and you get pregnant, stay Kiltz's keto. It's crazy amazing. And listen, again, whether you're vegan, vegetarian, carnivorian, it doesn't matter, or Mediterranean, all of it helps for sure. Ramirez Laura, good morning. Heather Page. Let's see. It's a great section, isn't it? And I do hack the guitar from time to time, and but I'm always learning. And I'm working to get into my pottery studio. And just remember, each of us needs to be creative. Egg quality, jungle. Let's see, how do you increase quality of anything? First, it starts in the mind. You must visualize the thing that you desire to have or for it to be as if it already is. Slow it down, cool it down. And by reducing stress to the mind and the body, you reduce the inflammation that causes disease. And this is where, if you look at, again, these are the 2 things I recommend, by the way. It's the Family Building Guide and Kiltz's Keto Lifestyle, all right? Oh, and don't forget our good friend Maria Emmerich. We have a new cookbook, Kiltz, the Fertile Feast Cookbook. But if you look at the Family Building Guide on low-dose naltrexone, CBD oil, yoga, meditation, check out the Fertile Secret with Danielle, and Fertile Hope Yoga with Aaron McCullough, sharing lots of great ideas how you can reduce inflammation, increase egg, sperm, embryo quality, and implantation environment. That's the key. All right, let's see. Rebecca Anderson, I'm waiting to stim again after missing my flight. Oh my God, excited to retrieve in Albany, doing keto, OMAD. Let's see, Omnitrope, yes. So I'm doing a lot of estrase, prometrium, 2 and 200 plus human growth or Omnitrope, 3 to 6 units a day. kiltz's keto lifestyle throughout. And you can simply start a stim at any time. And a baseline is simply, hey, this is what it looks like. Get your stim started, do your retrieval. If you started off with a thinner lining and a low progesterone, then you can do a fresh transfer. If the progesterone was elevated and the lining wasn't right, then freeze the eggs or the embryos and then come back whenever you're ready to go from there. Nichelle, sorry about that. Nichelle, Ash, Nicole, hello, Bridget, Garnet, hello. Let's see, Unique, thank you for joining. Carla, thank you for joining. Let's see, Atlanta transfers. I'm Heather, I'm working with Dr. V on Atlanta, getting the lab going. And so we're doing some work on that. Colorado has been a lot of our focus, but now we're getting into Sarasota and Atlanta in the southern states where there's a big need for so much and so much. Failed frozen transfer, progesterone never was high enough after upping meds twice. Can you explain what progesterone does? And progesterone is important for actual implantation. We like to see it above 10 in order to plan for a transfer. 20 is sort of that number that gives us a lot more leeway in all of this. So that's why we kind of pick 20. But as long as it's greater than 10, you're good to go. HCG wash, so human chorionic gonadotropin may help with implantation. So HCG, PRP, and Neupogen washers may help with implantation. Thicker linings, by the way. So these linings that are in the 18 to 20 millimeter range and triple lining are still good for implantation. If you start off with an 8 and you end up with an 18, that may be good to go. We're looking for what does it look like and where are we going from there? And we are working to make the changes as we see need to do for sure in this whole process. So we're going to do our very best. If it's not looking right, we'll say, hey, wait. But sometimes we're just getting our very best in what you have right then and there. Let's see. Dariana, Trinidad, hello. After a transfer, how much do you want estrogen? Estrogen has a lot of variability because estrogen drops after progesterone is added or ovulation. So anywhere between 20 and 3,000 could be. We like to see the progesterone, again, in about the 20 range, but greater than 10 is good for sure. And oral progesterone may be fine. Prometrium is oral or vaginal. Endometrial and crinone are vaginal. And then you can get the compounded progesterone for vaginal also. 2 years ago, successful Cbd oil. I highly talk a lot about CBD, LDN, and of course, kiltz's keto lifestyle. And again, our new kiltz's keto lifestyle is just out. And again, you don't have to be a carnivore. You could be a vegan or vegetarian or Mediterranean. This is a lot of kind of how I live, because I personally found that even a little bit of the carbs of the seeds and nuts and the fruits and vegetables damaged my internal environment too much. Let's see. Morning Love 56. Hello. Alexandrama. Drama 03. Hello. Jennifer. Hello. And Miss Donna Miller. Hello. Global team. Thank you to the global team, the travel team, all the in-house teams. To our financial team. Our financial team is really working diligently right now to improve on the financial side so we can help better get you moving, help you get into a consult quicker. We're really working with a lot of our protocols, low dose, mini dose, natural planning really helps. And we've seen so many that have done things like laparoscopy, hysteroscopy for endometriosis, or kiltz's keto lifestyle, or getting off the treadmill. It really helps tremendously. Why do you think ectopic happens with higher rates in IVF? Well, ectopic is not higher with IVF. So many people have ectopics naturally with IUI. They can happen with IVF also. And again, it's that environment. There's a lot of inflammation. And when you put the embryo or embryos into the uterine cavity, they can go out to the fallopian tubes. That's the challenge. We don't always control that. Taking naltrexone 50 milligrams. Well, naltrexone 50 is not low dose naloxone. So LDN is in the is in the 1.5 to 5 milligrams, which is more anti-inflammatory. People take LDN in the 25 to 50 in order to compound other toxins and working to detoxify from other narcotics. Let's see, wait for them. You have to call. And listen, I'm neurotic on using this device. So many people reach out to me. They send me emails, text messages, and I'm doing my very best. I'm working with our global team of providers, both nurses, practitioners, and physicians, and all of us together. But mostly you can share your ideas how to help improve your fertility journey. We've learned so much from you guys: LDN, CBD, autoimmune conditions. I talk a lot about reproductive immunology. I'm going to be working with Dr. Vidali with Prejimune and working on better ways to help test your immune system and giving you some advice that help guide you to either using our Immune 1, 2, 3, or Immune 4 protocols, which I think are very, very helpful. Acupuncture. Listen, whether you're using acupuncture, massage, meditation, herbs, or standard Western practices, all of them have potential. And so I think a lot of what you're doing here is looking for ideas. Acupuncture is another healing modality. And how many cycles do you put the oil under your tongue? Look at 30 to 60 days. It may take 3 months. It may take a week. None of us know the absolute answer to this. And time, remember, is created in the mind. But if you wait, if you give yourself 1, 2, or 3 months on the male side sperm, on the egg side female, and the implantation environment, everything we can do to enhance, again, by looking at don't forget the family building guide. And of course, let's see here. Kiltz's Keto Lifestyle. Again, the new one just came out. Download it on our website or go to Amazon. And the new keto cookbook with Maria, the Fertile Feast cookbook, you can go to our website or drkiltz.com and find that, fertilefeastcookbook.com. I think it's there also. Let's see. Happy Sunday, my son. Let's see. Angeliski. Let's see. I'm IVFing. Tara Lynn, hello. Let's see. Victoria Bates. I was on hold for over an hour the other day. Once I spoke to someone, they were full of info for me. And I really apologize. We have been so amazingly busy, and we're working to add more help in all of this. And Rebecca and the call team is doing amazing. Please, please, please don't give up. Be patient. And there are bumps in the road, obstacles. But turn the obstacles and the into stepping stones, into growing stones, into growing and building your dream. Okay. So many are waiting on this journey, but I'm here with our team members at all locations globally. But so much of what you give to all of us, we're learning from each and every one of us. Scared my 10th try will not come. Hope I get, and Angie Plotz, 315-416-9872. If you text me, I'll help and get you in a little sooner. We do have some openings. I'm doing our very best to get you guys in as soon as possible. So much of what I wind up doing is coaching and cheerleading, getting people in, giving them advice, which sometimes is a little different from other practitioners. For whatever reason, it is what it is. All right, Brittany Lay, doctor's looking for when doing a hysteroscopy. So the hysteroscopy is looking for scar tissue or adhesions, little polyps or little fibroids, and sometimes just looking and finding it normal and doing a little bit of a scratch procedure where we clear the inside of it, like tilling the soil, which aerates it and brings the blood flow and allows the oxygenation and allows the growing of the glycocalyx, which are the sticky little particles of the membranes of the endometrial lining, to help to stick and grow. Hysteroscopy would give me an answer to inside why transfers has been not possible. Speculum was not able to get into my uterus, So let's see. That's interesting. I'd be glad to take a look at that and see what's going on and whether there's difficulty. Sometimes you may need a Valium for your transfer. You may need anesthesia for your hysteroscopy or even your endometrial biopsy. If it's too painful, we doctors, on all practitioners, must stop and either give you a little Valium, give you some sedative, or give you some conscious sedation. And we can do that at cnyfertility. All of our locations can help with that when we're doing a retrieval or a transfer, by the way. Valerie, let's see, Valerie Pipacella. Blighted ovum is another miscarriage, which is either due to a bad egg, bad sperm, bad embryo, bad environment within our bodies. And that's why we're talking so much about how do you improve your environment. Your environment is improved by changing what's going on, first in the mind, and then in the mouth, and then how you move the body. And so much of what I recommend is you want to get, okay, I have a standing desk at work, and I do a lot of this. And I'm just doing this. I put a stool under, I rest, I have my working desk up high. And so there are ways we can all do it differently. And if it's not working, imagine that it's working the way it's supposed to as you keep moving in this journey to help improve your outcomes. Never, ever, ever, ever give up and have faith in God. And God is within all of us, no matter your religious or non-religious belief systems, by the way. 3 natural pregnancies that have been on my tubes tied, 2 failed transfers with us. Would love to figure out why baby isn't sticking. That's where immune stuff comes in. And we may look at the Pregimmune testing with Dr. Vidali. It may be you need the Immune 3 or Immune 4 protocol, but don't forget a laparoscopy, hysteroscopy to look inside for endometriosis, clean things out, flush it out. And sometimes you have to clip or remove the tubes, or you have to reanastomose the tubes to try to bring them back together so the natural flow of things can happen. My bet is these tubal ligations are not allowing the natural flow of fluids, and things get caught up in there. That's why sometimes you want to either ligate or remove the tube, but more proximal to the uterus, by the way. Let's see, and affordability is what I work towards. And so the $39.95 is the cash price, by the way. And we're going to work to keep it that way. There's some add-ons. If you want to do the add-ons, we do it. But look towards more lower dose protocols, mini protocols, even natural. You can monitor natural ovulation, a trigger shot, and then a retrieval. And there are lots of different protocols in all this. And why one or another? We have so many different things. My personal bias is low dose with some letrozole, 10, 100 to 200 of gomer follistim plus 20 to 30 of HCG. By the way, I'm doing HSG, might have, and HSGs, that's why I recommend saline sonograms, hysterosalpingograms, laparoscopy, hysteroscopies, because you want to flush out all the, basically think of it as the mucus and the sinus snot that gets caught up in our pelvis. It's the same thing. And it's all due to the wrong diet for the human miracle machine. And I talk about us, we're the miracle machines, all of us. No matter who you are, where you've grown up, what your past has been, your body is the miracle machine. And you can change it. One meal at night, high fat, low to no carbs, cook the carbs well, and have faith and consciously be mindful of the beautiful person you are inside and out. And if you're fighting with the thing in here or things out there, you're only hurting this beautiful miracle machine. Learn to love it more. And loving it is the spiritual guide to creativity. And that's the little secret, by the way. And if you haven't read my book, The Fertile Secret, you must. If you haven't read The Secret by Rhonda Byrne, you must. And the secret is that God is all of us, by the way. It's not out there, by the way. Hey, carnivore yogi, how you doing? And look at this idea. Carnivore is radical. And to me, I've done it for over 10 years now, and it's never been better. Do I, from time to time, have a little bit of French fries or, let's see, a little Kiltz's keto ice cream? Yes. And but we're all just learning so many amazing ways. Let's see, when I can know when to get baseline HSG if I don't have periods to gauge when to get it done. Charmis Michelle, simply make sure you're not pregnant, get the HSG. You don't have to have a period to get a hysterosalpingogram or a baseline or get started. You just simply have to get your ultrasound and blood work to know that I'm not pregnant, and get the HSG or start your stims or do an IUI. Letrozole trigger intercourse IUI and IVF is one way to do it. I've shied away from Clomid because it has a lot of side effects that a lot of people don't like. I don't like it, but it's worth doing and trying. Prime me for 3 months and my cycle seems to fall during Christmas. Do you do egg retrievals during Christmas? We're not closed during the break, but Christmas Day is a holiday, and whatever you choose as a holiday, you choose it. Rebecca Lynn Anderson, we may transfer 2 tested embryos, but it's individualized. And in general, 1 is the number of PGS normal embryos, by the way. Sarasota, Florida location going to eventually offer the same services as New York. Yes, we will be. And Ms. Tia has been helping with Dr. Condrup and the whole team, Chris and CJ and Johnny, doing a ton of work there, and we're working to get it going as soon as possible. Second round of IVF, we never made it to transfer. I'm worried this will happen again. Should I wait for another cycle? Again, so I recommend freeze on day 3. Don't go to blast if you didn't make blast. If you didn't get any embryos, do it again, but freeze on day 3. And look at both the Family Building Guide and Kiltz's Keto Lifestyle. I recommend both of these. And don't forget, Miss Maria Emmerich is amazing. And we have a new book coming out with Maria, and it's all so many great things to do. And we do natural transfers. We do letrozole trigger transfers. We do estrogen progesterone transfers. We also do medicated with either low-dose gonadotropins in some cases, that what you might need. But look and keep reading and talk to others. What did you do and how can I do this? Tammy Delp, a couple of weeks I had it. All right, let me get back to you, Tammy. I'm sorry. Sometimes this thing goes so fast. We've seen you in a couple of weeks. Awesome. It's going to be a transfer. We have A39 embryo, A25 embryo, A13 embryo, and the embryologist says we transfer all 3. Maybe, and I'd be glad to look at that and help you make a decision whether to transfer more than 1 or 2. In cases you can sometimes do that. Don't forget the Facebook groups for support. Check out the Fertile Spirit with Danielle, a place to talk to someone, to video with someone. If you want to do a video consult or follow-up, just tell the provider when you talk to them, can you please do a video chat with me? We can work that either through Skype or Zoom for everyone. We're making sure we have that ability. We're still working through our COVID craziness. I recommend your vaccine, but if you choose not to do it, we're here to take care of you, by the way. Keto work mostly in egg quality and endolining. Keto works for sperm, eggs, embryo, and the lining implantation environment. Keto is king, queen, and we're lionesses and lions. This concept is crazy. I don't test my urine for ketosis or my blood, but by eating 1 meal a day and mastering the mind to having faith and believing in the thing you desire as if it already is, it will be that or better all the time. That means have belief in God. How does Humira work? Humira and Cimzia, they block your immune system from overreacting. And basically, like COVID only kills you because it stimulates your immune system to overreact. Your immune system is on hyperdrive, right? That's how people die of peanut allergies, of bee stings, because they have a hyperimmunologic response, an anaphylactic response. And Humira and Cimzia and IVIG and steroids and Benadryl, all of these things, and Plaquenil and Neupogen, all of these things help reduce your inflammation, by the way. Love Albany. Dr. Ditkoff and Grossman, thank you. And listen, if at any time you're talking to one of our providers and you didn't like it or feel comfortable, please reach out and say, can I talk to someone else? That didn't resonate with me. You know, we're all humans. We don't resonate with everyone. That's the nature. So if it's not sounding, feeling right, just ask for someone else. Let's see, Christina, been my nurse, awesome. You know, we have a great team. Albany, Syracuse, Rochester, Buffalo, Atlanta, Colorado, Montreal with Dr. Faruqi, Dr. Ivanov down in Philadelphia. We're working to get that better. And I'm working with your OBGYNs, your fertility docs, wherever you're coming from. This way we can keep the cost down, make it more affordable, that you can go to an OBGYN anywhere or a fertility doc and ask, hey, can you help do my monitoring? We'll send you to radiologist or LabCorp or Quest to get your blood work. Simple endometrial hyperplasia. Yes, you can get pregnant with that. That actually might be the best treatment, Yennefer. AMH 3.4, 33 years young. That is good. All normal range. What do you think will recommend my consultation is 1 month with Dr. Ditkoff, 4 Boss Lady 88. That sounds good. Get your preliminary testing, your HSG. Talk to your doctor about a laparoscopy, hysteroscopy. Get your blood work. Do your genetic screening, a semen analysis. These are all things that you might choose to do. You might say, you know what, I don't want all the testing. I either want to hear what your best plan is for me. I want to do IUI or I want to do IVF or donor eggs, donor sperm, donor embryos, or a gestational carrier or a surrogate. All these things are possible, by the way. Victoria Bates, 6.5 AMH, PCOS getting ready to start soon. Inositol, kiltz keto, LDN, 1 meal a day, and have faith. And it may be either a letrozole trigger intercourse IUI, it might be IVF. Dr. Corley loves metformin, 500 milligrams, the most I recommend. I don't love metformin, but we all have a little differences in opinions, which is okay. I don't like the birth control pill. Dr. Chang does. I recommend not using the pill. I recommend estrase prometrium and add some human growth for priming, 3 to 6 units a day for 2 to 4 to 6 weeks, and then get stimulated at any time. You don't have to get your menstrual period if you're doing banking of eggs or embryos and not doing a fresh transfer, by the way. Trauma is so difficult. I know it sometimes is. Senir, child of the King Kelly. Hello, how are you doing? And thank you to everyone for sharing and joining. We really appreciate it. Miracle 2-year-old, awesome, yeah. Third clinic, last hope. Now, never give up hope. And all those clinics out there are really amazing. They're doing a great, amazing job. We should be so grateful and thankful for all the fertility doctors out there. And never, ever, ever, ever give up. All right? Never. Gina De Matteo, low AMH. A low AMH is another indication of inflammation. So you want to reduce the inflammation. Remember, lots of water, a little bit of coffee, a little bit of tea, eliminate alcohol, and go to 1 meal a day. Breath and smile intermittently, always, every 5 seconds, 10 seconds, keep breathing and smiling. And to bring up an AMH, you want to reduce the inflammation in the ovaries. This is where, again, if you go to the Family Building Guide, a lot of stuff on improving your AMH. This is where human growth hormone, Omnitrope, Cerevital, Somaderm, some of the other methods we have. We're working on adding that also to some of our supplements that may be helpful for you. It's really kind of crazy, interesting concepts and ideas that we find helpful. Don't forget acupuncture, massage, meditation, and prayer, right? That'll help those low AMHs for sure. I've seen low AMHs come up. I've seen plenty of people with low AMHs get pregnant and have a baby. So don't use that one little thing as the thing that says, oh, I can't, it won't work. Not true, by the way. Do I keep myself from being hungry during the day when doing 1 meal a day? Rebecca, that's a hard one, by the way, for even me. I stay out of the kitchen. I do not go to the kitchen in the office because I go there, I want to eat too. But I've been practicing enough. So yesterday, T and I went out and I had a amazing grilled cheese sandwich from the cheese shop in Sarasota. And with salami on it. It was great. And then I had a little ice cream. Oh, I love ice cream. And a chocolate cookie. Oh my God. Listen, that was my one meal. I did it about noon. Okay, because I did that and it was a little high on carbs, which I almost never do, I said to myself, you know what? Water, a little coffee, that's it. I was invited to go out to dinner. And what did I say? No, thank you. Because if I did, what would I have done? Eaten another meal and tortured myself. So you got to take control of the miracle machine and sometimes say no thanks, stay out of the kitchen. But I work on having bacon, eggs, butter, beef, a little bit of ice cream and salt. And sometimes I have to make sure I don't make the ice cream because I'm like you. What do I want to do? If I see food, I want to eat food, right? Let's see, trying right away after recent failed second attempt. HCG always under 1. So again, this is, you got to go right to the Family Building Guide and Kiltz's Keto Lifestyle. All right. And you guys be painters, potters, poets, play music, do things that inspire you every day and recognize. And I listen to my best is I'm always listening to something that is inspiring. I love Joseph Murphy, James Allen, listen to excerpts from the Bhagavad Gita, from the Quran, from the New and Old Testaments. Listen to spiritual texts that will help inspire you. And I listen to them when I'm in the pottery studio or I'm simply, I get out my journal and I start writing. I was watching the sunrise this morning and it was really, really inspiring. And I'm writing, I'm taking pictures. And if you haven't read this one, it's really good. Steal Like an Artist by Austin Cleffin. And I've always said, let's see, good artists borrow, but the best steal. I think that was from, Picasso. We're all artists learning from each other, by the way. So if one thing isn't working, dig deep, ask questions. What can I do differently than I've done if what I'm doing isn't working? If you do it enough and what you're doing isn't working, change it up. Hey, Vanessa Rodriguez, thank you. And Tiffany, thank you. Sharing the support groups, the Fertile Spirit with Danielle, Fertile Hope Yoga, and of course, the Facebook, Instagram Lives. And we are all goddesses and gods on this God journey. And it's created by God. And God is nature. God is you and I. God is the beauty within all of us. And don't give up on that beautiful, beautiful journey, by the way. And Ro, thank you very much. We're all as inspiring as we can be. And you guys inspire me every single day. Is LH at baseline too high? Emily, it's not. It's fine. These LHs, and sometimes your LH might rise and indicate ovulation. We can do a retrieval the day after a natural surge, and sometimes we'll get eggs for sure. How long after cycle day 1 is a frozen day 3 transfer? So usually for day 3 embryos versus blast, so cleavage stage versus blastocyst, 4 days of progesterone for cleavage stage and 6 days of progesterone for blast stage. That's in general. But if you're doing a natural cycle, you ovulate on day 14, then at about day 15, 16, 17, 18 is transfer, 19 and day 20 or 21 for a blast, by the way. But quite often we're managing your cycles, we're monitoring your cycles, we're giving you some timing in your cycles, help guide you in the journey, by the way. Laura, let's see, 1 meal a day. Should we not worry about packing on extra calories over ovulation? In general, we pack in too many calories for the human Ferrari. 1 meal. Remember, your body uses fat as energy, and it's always fat. You're never using your food you ate today as the energy today. It must go to the liver, converted to fat, and deposited everywhere. So it's a hard one, but you're worth hard. Anyone can do easy, but if you really want to like strive for the most amazing, you are the miracle machine, and you can do hard for sure. let's see, my transfer last week, I go for my E2 progesterone levels tomorrow, keep all of us, I always say like this, and have faith in the way. Let's see. If you need more calories, add more fat, by the way, but 1 meal to 2, that's it, right? But remember, the more you pack the calories in the belly, the more heat inflammation it causes. Add more fat. Fat is the fuel. Fat contains twice the calories, but we don't eat fat. We eat a standard diet, which is a low-fat, high-carb diet, which is deadly for the human Ferrari, by the way. Marcy, Snoozy, Belly, Chica, Kikers, Ashwald, hello. Difference between modified natural and natural for transfer. So for Boss Lady 88. So basically a natural is you're monitoring when you have your natural surge, and then you schedule based on that. Some modified natural is either no meds, we monitor with ultrasound, we give you a trigger shot, or you've done letrozole and a trigger shot. I call those modified naturals, but a medicated technically is adding either letrozole or gonadotropins or estrogen, where a modified natural is going to be a trigger shot, and a natural is you ovulate and then you schedule your transfer. I still recommend do a blood draw to check your estrogen and progesterone levels. So if we need to add a little bit of estrogen, progesterone, we can do that. Christy, how are you doing? Let's see. So Christy had, let me get this here. Had a fresh 5-day. They had my start PO day after retrieval, making dose 5 of PIO morning of transfer. It's different for fresh transfers. Fresh versus frozens are different. So when we schedule that fresh transfer, we count from day 0 as the day of retrieval, and then you count from there. So that's why it's kind of a little off in all of this. But otherwise, you can also add the ERA or the ERP, endometrial receptivity assay, through iGenomics, and ERP through Cooper Genomics, and that might help give you a little bit more knowledge in all of this. I'm not a big fan, Victoria, of meal replacement shakes at all. My belief is we should be eating organic and natural foods that God has gifted us in nature. And all of this processed stuff, I don't recommend it. Rashid, PRP, platelet-rich plasma. So you can draw your blood, separate the platelet-rich portion of the plasma, and either infuse it in the uterus, inject it anywhere in our body, in the testicles or the ovaries. It may help with reducing inflammation and bringing some stem cells that may help rejuvenate the egg and the sperm environment to make better eggs, better sperm, and obviously help with the pregnancy. Call October 4th. I'm ready to start this cycle again before the end of the year. Do you have any early appointments? Jane Bino. Let's see, 315-416-9872. Text me. I get to whatever texts I can in the day. Sometimes I have to say, text me tomorrow, text me on Monday, text me next week. I'm doing the very best I can in this day for sure. Thanks everyone for all your great questions, for sharing, for being with us on this beautiful Sunday morning. Morning is my best time of day. Although sometimes I'll work to get online with you guys in the evening. It's lots of different ways to do that. 2 eggs, let's see, retrieval, all not good quality. My MH 2.5, my age is 40. Facial. So remember, AMH, FSH, LA, these things don't tell us whether we have good eggs or bad eggs. They're markers to give us a hint at it. But this is, again, where you go to the Family Building Guide, go to Kiltz's Keto Lifestyle for Fertility. You go to Amazon. You go to our website, drkiltz.com. I'm working on so many ideas to help acupuncture, massage, meditation, prayer, visualize, cool the body down. So I love the hot tub, but I also get into the cool pool to cool the body. And less hot tub, less strenuous heat creating exercise Play the guitar, piano, poetry, painting, get into the pottery studio, do something that's inspiring and creative for you to improve you. And the outcomes are only what you believe them to be. PGS testing for over 40 with a history of multiple miscarriages, Maria Schwartz. I don't recommend PGS testing for that. It's an immunologic autoimmune problem. It's bad eggs, bad sperm, bad embryos, but it's the bad environment that causes these things, in my opinion. I've seen normal PGS embryos transferred, miscarry, and genetically show up as abnormal chromosomes. I've seen abnormal embryos be transferred and deliver as normal babies. So when to do this, that's the mystery. Now, some of my docs believe differently. We will do whatever you believe in and you want. We're here to support you on this journey in order to create the beautiful gift you desire. Go for a walk, Carmelo Booty 91. Light walk. I go for a light bike ride. I can always breathe. I can talk. I can listen. I'm not sweating because that's heating up the core. When you heat up the core, you heat up remember, what's the core? The core is your ovaries, tubes, and uterus, the testicles. All this environment gets heated up. That's the negative for our bodies, by the way. Let's see, hugs and kisses, adenomyosis. It's basically, think of the uterus as a filter. All the inflammatory particles get caught in there. It causes inflammation. This is where Orilissa, Lupron, Letrozole for 3 months at least can help with that. And this is, again, back to kiltz's keto lifestyle. 1 meal a day. Let's see, high fat, low carbs, no sugar, but that's not true, no sugar. Look at white sugar to me from time to time is okay. Complex carbs take so long to digest, you're always secreting into your bloodstream, by the way. Hard time finding your keto fertility book, can't find it on the website. This just came out, so the new version is coming out, and I'm working with Will. I'll make sure it's out with a link this Monday. It just takes a little time for them to upload the new keto. The old keto lifestyle is there, but the new one, it should be out this week. And thank you for reminding me. I've got to do some work to get Will and Patrick and the team to get it out there. And if you go to drkiltz.com, we'll put a link there that you could simply download it. Easy, by the way. Ash J. Walt, AMH 14, higher AMHs tell us that you likely have metabolic disorder, PCOS-like, in my opinion. This is where kiltz's keto, 1 meal, inositol, LDN, CBD, and you could do a letrozole trigger. Absolutely. Think about a laparoscopy, ovarian drilling, or ovarian acupuncture. I think that can help a lot. 1 month before IVF, we Jode, yes. Acupuncture, once a week, once a month, massage, meditation, prayer, play the piano, play the flute, the clarinet, whatever, instruments, music, calmness, right? But you want to listen to a good book. Check out The Fertile Secret. Check out our books on Amazon and also on audible.com. 315-416-9872. And again, I give that out for, hey, I can't get anyone. I need some help. Dr. Kiltz, can you get me in earlier? Yes. But like today, I'm kind of shut down for today. Tomorrow, back to the officina. Dr. Corley's taking a break this week, spending time with his wife. And we all need it from time to time. And I need to put this away so Tia won't throw me out and I can have some time with my beautiful partner. And we all need to sometimes shut it down, right? Transfer of 2-day 3 results in miscarriage. Should I try transferring 3 at 40? Maybe, but talk to the team about doing the immune 3 or 4 protocol. Let's see. I think I always go back to this. Again, it changes depending on, but if you look at the sample immune protocols, you might find some ideas that you might talk to the nurses, the practitioners, and say, I want to do level 3. I want to do level 4. And My nursing team is quite adept at this, and they can help make that. Let's see. Tara Dorico, yeah, I enjoy the conversations, by the way, and I'm grateful for you guys sharing with us what are the challenges and the troubles and how may we do better. We want to do that better and better and better for you and everyone else out there. Are taken prior to the transfer. Yes, I generally recommend it starting at the beginning of the cycle, but some of these meds can be started the day of the transfer and continue at least through 12 weeks. We often will hold off on the aspirin and lower the steroids, but some of you may need it throughout that pregnancy or go longer, and we're here to help with that. Let's see, Orilissa or Lupron for 3 months, at least 2 months to 3 months, and letrozole. So I usually do 200 of Orilissa or 11.25, I think, is the dose for 3 months Lupron plus letrozole, 2.5 to 5 milligrams, will help reduce the adenomyosis, which is endometriosis in the muscle of the uterus. And again, how does it happen? From a standard global diet, high carbs, low fat, and then 3 to 6 meals a day. We're meant to eat 1 or less, not 3 to 6. I know it seems crazy, but you shouldn't do it. Do we get our protocol when we call on the first day of our cycle? Typically, we like to make sure that the protocol has been placed ahead of time. And I recommend a 10, 220 with human growth. You could go to 10, 330 or 10, 440 for these protocols. If you're going to use Menopur, then you're going to use Menopur about 75 to 150 is the dosing for that. Hi, Jill, Brenda, Vanessa. Let's see, first 2 cycles. So is there a way to reduce fibroids? So best way is not to let them happen at all. And our standard American diet, which is a high carb, low fat diet, 3 to 6 meals is the cause. I know it seems crazy. To me, kale, Brussels sprouts, broccoli, asparagus are deadly. Almond milk, oat milk, and soy milk are deadly. They're not, there's no such thing as milk. If you're going to have milk or cheese, cream or cheese. But I would say that reducing fibroids usually is either excising them. You can try Lupron or Orilissa for the same thing as adenomyosis, but quite often they need to be removed. All right. And stay on, listen, kiltz keto is kick-ass amazing. And I'm making it up. It's all been around for infinite numbers of years. 500,000 years ago, we did not eat 3 to 6 meals a day. We didn't carry around a shake to mix and eat it. It's deadly. Deadly, 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 deadly. We're carnivores. We're lionesses and lions. We're not pigs and cows, in all respect to all pigs and cows, by the way. And we need to labor ourselves as miracle machines. No matter your size or shape or age or weight or gender description or color or culture, doesn't matter. We're all beautiful children of God, all of us, and we have to have that. And when you come to us, my team must take care of you as a child of God with respect and love and listening. So help us do better, my team. We want to listen to you. And there's a lot of stress and struggles for all of us. It's the nature of life. Let's see, the EST veggies to add if you have a hard time with strict baby. Cook the carbs well. Broccoli, asparagus, cauliflower. For me, white potatoes, no skin, white rice, best. Add the butter or cream, game changer, and some salt, by the way. Come on. We are the miracle mystery machines, and God is made by us. God is within all of us. It's as simple as that, by the way. All right, Kellen, let's see, Grizzle, pap smear, but the report said severe acute inflammation. Okay. Anti-inflammatory, antimicrobial protocol. What is it? Levaquin, Flagyl, Valtrex, and Diflucan. The 30-day plan. Remember, if you have vaginal, cervical, or uterine inflammation, it's everywhere in our bodies. What is it caused by? In my opinion, it's caused by a low-fat, high-carb, 3 to 6 meals a day. What do? Add LDN, CBD, kiltz keto. Now remember, Kiltz's keto is one meal, high fat, low to no carbs, cook them well, and have faith. That doesn't mean you can be a vegan or a vegetarian. A vegan is coconut oil, hemp seed oil, but you got to get the fat, and that's harder as a vegan. It's a little simpler as a vegetarian where you can add cream and butter. But again, it's simplifying the carbs and that one meal a day. Remember, what is the fuel for the Ferrari? It's our fat. We all have it. All have it. It's you better have it or you're dead, by the way. Keto is a diet we recommend for women doing IVF. Keto is the most anti-inflammatory diet around. The concept of keto is the highest fat content and the lowest carb. But I also add to it, Kiltz's keto is one meal a day because you want to really reduce the inflammation. It's the food that causes most of it. Now, again, you can eat whatever diet you want. You may do IVF or do surgery or do IUIs, and bingo, it happens. So I'm just giving different concepts and ideas that'll help get you to where you want to go. That's what this is all about. So again, you can do paleo, keto, many, many, many anti-inflammatory concepts and ideas, acupuncture, meditation, prayer, and visualization. And again, I support you as a vegan, as a vegetarian, or a carnivarian, a Mediterranean, a pescatarian, whatever you choose to label, but it really, really, really does help tremendously. Let's see. There are two different things, making sure I'm getting to all your questions as best I can. I wish I could get to all of them. Let's see. It's my pleasure, by the way. And oocyte maturation. Do you know much about oocyte maturation defects? Well, Jackie, that's really a challenging one. We do have some people that no matter what, we don't get mature eggs, or we get mature eggs, but we don't get fertilized eggs, which may be either an egg problem or a sperm problem. This is the difficulty. Is it something you're consuming that's creating the blockage, either breathing, drinking, or eating, or it's getting through our body in one way or another, or it's something you're born with? This is the challenge. Is it a DNA defect? Is it something that maybe in our newer designs of treatment, CRISPR, may be able to help that in the future? It may be donor eggs or donor sperm, but if the protocol you're using isn't working, go to natural. Try a letrozole trigger. Try maybe a 30 to 60 days of an anti-inflammatory process. Go to a strict Kiltz's carnivore keto and look at Judy Cho's book on carnivore, Marie Emmerich's on carnivore, and Carnivore Cavelli and Carnivore Yogi. There's so many people out there. I'm just so inspired by many different ideas. Again, if you're a vegan and you're not having any issues, then stick with it. If you are a vegan and having issues and you want to look at a keto concept and lower inflammation, but stay vegan, stay true to that. But if it's not working and we're really frustrated, well, that's where you might need to look at some ways to go either vegetarian or go and add some meat for some reason. But again, we're just giving ideas that you might look at and be open to. I'm not blocked to any idea and open to all ideas, by the way. Don't have my consult until December. Would my OB be able to give me a prescription for those adenomyosis medications? Yes, your gynecologist might. But again, you might work to get in. Let's see. It's already October, November, December. It's coming. Craziness. Let's see. Gate Tree Rick Noth. How are you doing? Ladies, you know what the link is. Kelly. Lupron Monday. Chris Z. Oh, thank you to Chris Z, Dr. D'Souza, Dr. Chang. Our Buffalo team is amazing and grateful for all of them. Let's see, Amy Pavia. Once you get your consult, we'll give you a protocol, get you going. When you're talking to your providers, please give a protocol for either IUI or IVF at that consult. The AMH and these things don't matter so much. We know the general concept. I always say start with a mini protocol, 10, 220. You can go 300 or 400. If we trigger with Lupron, your risk of hyperstimulation is low enough that I think you can move forward and go ahead with this. If you're going to use Menopur, then you lower the gonal dose, and it's either 75 or 150 on the Menopur, by the way. All right. All right. Sherlyn, awesome. And your success stories are really important. We should all be sharing successes, but sharing the failures and the hurt and the heartache. We need to all listen and learn together. And that's what the Fertile Spirit is about. If you go to thefertilespirit.com, Danielle and the team, we're listening and learning all together. And we need to be listening and learning all together. We all have frustrations and pain and problems. Dead people have none. Live people are gifted these treasures of troubles in order to help us grow and create and learn even better. 5 retrievals, 87 eggs, retrieved 64 mature, 29 fertilized, 11 embryos, 7 day threes, 4 blasts. Husband and I agree, only 1 more retrieval. Just had hysteroscopy, laparoscopy, end of July. Said, BC, I'm not comfortable. Don't use the birth control pill. Estrogen, progesterone. For some reason, Dr. Chang loves it, but I don't recommend it. Estrase, prometrium, and priming, and do a day 3. Do not do blast. Freeze on day 3. An immune 4 protocol. Look at, again, the family building guide, here to help, and we're changing it up. We're all learning together. Listen, plenty of people have babies. You can use the birth control pill if you want. I don't recommend it. The concept and idea of a birth control pill doesn't make sense to me in this business. Let's see, Estefani, how often do acupuncture? Once a week, once a month, once every 2 weeks. But remember, every day, pray, meditate. And remember, God is within all of us. And the baby you desire is in the mind. Hold on to that. This is where you create the vision board. You put the pictures up on the wall of the things you desire as if they already are what you desire. And they will become that or better. That's the crazy story here, right? Chat about egg preservation in your 30s. Jessup, basically, if wherever you're at in the journey, if you're thinking about having babies in the future, put the eggs on ice, the sperm on ice, the embryos on ice, put it on ice. The best thing to do. I cannot predict absolutely whether you need it or not, but we will never know that. It's an insurance policy. So do a stimulation, standard dose, high dose, or low dose. I say start standard or low, and serial stimulations are the way to go, by the way. Heather, let's see, fresh transfer, which day do I transfer? If it's a fresh, I recommend day cleavage stage, but cleavage stage is either day 2, 3, or 4. Blast stage is either day 5, 6, or 7. So we do not work on Sundays. We are off on Sundays at CNY Fertility. Some of our offices are not open on Saturdays. We're doing our very best to help get you to your success. But you can either do a cleavage stage or a blast stage. I usually say 4 or fewer embryos on fertilization day, do a day 3 freeze or transfer. Again, day 2, 3, or 4. If you have 5 or more, in general, go to day 5, 6, or 7, or freeze on day 5, 6, or 7. But for some people, they have bad sperm. They didn't blast well. Do a day 3. For some people, like that's not working on day 3, try a blast. So again, if what you're doing isn't working, be open to do something different. Laparoscopy, hysteroscopy, doing egg retrieval. Olivia, so much. We can do hysteroscopy in general, but laparoscopy usually not, because it's a longer procedure, and big ovaries make it a little harder. Injections in about 2 weeks. Recommendation on daily amount of caffeine consumption. How many milligrams? Listen, I'm a caffeine craziness. I was off coffee for 3 months, off almost all caffeine. 0 is probably the right amount, but do 1 or 2 cups a day at max. I don't know the milligrams. I don't know how many milligrams in a cup of my coffee. But if what you're doing isn't working, stop doing it. Caffeine's not good. We know alcohol's not good, but a little bit from time to time of caffeine, but eliminate alcohol, by the way. Small veins and blood draws are very difficult. My monitoring doctor recommends electrolytes. How do you recommend getting them on kiltz keto? Listen, if you can't get blood draws or intravenous, don't do it, right? A lot of the things you do is, again, kiltz keto is the best way. Water, the majority of the bone broth is really good. Add some, I'm a salt fiend. I think that's the healthiest thing for all of us, by the way. Low AMH always mean bad quality eggs, or is age more important? Age trumps everything, but in general, you have to have belief and faith in your eggs, your sperm, your embryos, and your beautiful, amazing body, by the way. 300 Menopur 150 going for, it is, let's see, Razan 41, 300, 150. That's an okay dose. I personally like 10, 220 for everyone, 10, 330 or 10, 440. Gonal F, Gonal Menopur 300, 150. That's okay. But I do a tremendous amount of 150. 225, 75, 150, 75. If you're going to go to the 300, 150, that's okay. But I do a lot of the lower dose protocols. Anna Robinson, at what point do you decide to transfer 2 instead of 1? Age-wise, if you're over 35, doing 2 is okay. Day 3, blast, usually day 1 or day 2, but it's an individualized conversation. 2 increases your risk of multiples. If you said, I don't want to have multiples, then don't do 2. A. Simmons, Desiree, Rollins, hello. I use Ultima electrolyte powder in my water every day. Tastes good and get it on Amazon. That's a good one. Listen, but if you do bone broth, nature's way, that's the best way. But magnesium and these electrolyte supplements, I think, can be helpful for sure. So thank you very much for Ultima electrolyte powder. We should add one to our molecular fertility supplements. I think that would be helpful for everyone, by the way. Let's see. Portia Brownridge, 2 miscarriages through frozen transfer. What do you suggest next? Don't forget laparoscopy, hysteroscopy, kiltz, keto, and immune 3 and 4 protocols. And never, ever, 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 ever give up. And don't forget surrogacy. Sometimes you need a surrogate. A gestational carrier may be the thing that you need, by the way. Follistim better than Menopur. Kelly, I think that Follistim and Gonal, very similar. I don't think they're different. Menopur adds a little bit of LH. That's why we use the low-dose HCG along with Gonal or Follistim. So by using Menopur, you could actually use Menopur alone or some combination of 150, 75, 225, 75, or 150, 150. You know, there are a lot of fancy chefs in this process, and we all think we know the answer, but we're all just doing our very best. Let's see, Brianna Vasquez, how do you optimize successful FET? First of all, have faith. Never, ever, 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 ever give up. Remember, inside of you is the way, and you are capable of holding that. Don't let that go. And again, look at the Fertile Secret that I wrote a number of years ago. We have a new one we're going to be working on coming out. Really excited about it. And stay as kiltz as keto as you can. Remember, 1 meal, high fat, low carbs, and hold the faith every single day. My blessings to everyone. Thank you for joining. See you guys on next Sunday morning at 10 a.m. Maybe I'll do an evening one this week. And again, don't give up and hold faith. Share your concepts and ideas, how everyone can be on this journey, whether you use donor eggs, donor sperm, donor embryos, or adoption. Know that success is within you this day. God bless you, my friends. Take care.